Chris Jones have been involved in helping her with her orthopedic needs. So Sue was born 1 year after I was, so we remember each other's birthdays. And she could correct me, but this is what I threw on the slide. It was the late 80s that I first started seeing you, is that right?
You diagnosed me with RA.
And so we got her, we gave her the diagnosis of rheumatoid arthritis. She gave me a list of the procedures that she's had over that time we've known each other, and it's in around 40, and about half of them I have been directly involved in. So she, as we end this meeting, we go back to Mac Clayton a little bit. Mac and Charlie Smith, who's kind of the father of rheumatology, wrote this book together, Surgery for Rheumatoid Arthritis, and Sue's a couple of the chapters. So, let's see what I got here. We're going to focus really with the live presentation. We'll give you an exam and Sue's commentary and focus on her left shoulder a little bit. But going back in time, from an orthopedic perspective, she's had total knees that I've done. She's had a revision of her left total knee for infection, so she had a 2-stage revision. She's had multiple cervical procedures, including initially C1, C2, and subsequent to that, 4, 5, 6, and 6, 7, I think. She's had a Clayton 4-foot arthroplasty. She's had total shoulders that I did. I did her original shoulders in the late 90s. She's had right elbow and subsequent removal of a right elbow, but she and I had went through the course of trying to salvage that, multiple procedures to address infection. She could add to this as well. Her hips are good, and she's had some multiple hand procedures. So she has kind of the classical presentation for inflammatory arthropathy. I'm going to have Sue, is this mic live here, Mike? Mike? So I'll have Sue kind of shift over next to Chris there and give her perspective on a kind of a long history of involvement with her orthopedist.
Thank you, Sue Ferguson. I was diagnosed by Ted for RA back in, what year was that?
88.
Anyway, back then, RA was, they didn't use the biologics, so the destruction to my joints was just ongoing and ongoing and ongoing. And luckily, I was lucky to find Dr. Stringer to help me, and he's always been there for me. I would say I'm in pretty good shape right now, considering having had this for as long as I've had. What else do we do? I didn't know I was making a speech today.
Chris, we're going to concentrate at least on the exam on her left shoulder. So in the late 90s, we did a standard glenohumeral arthroplasty, both sides of joint. And then as her needs continued, Chris Jones joined me in practice, and he got to meet her pretty early in that process. So Chris, why don't you talk about what you've done, and you've got some x-rays to share.
Yeah, I have. Can you put my slides up? Let's go ahead and advance forward. Yeah, so I met Sue in 2007. Again, this was a shoulder done by Dr. Stringer in 1999, and when she came in, she had done very, very well for that 8 years, and then started having increased pain and loss of function. And when I initially saw her, she really didn't have any ability to lift her arm. So we x-rayed her at that time, and it appeared that her humeral head was high riding, consistent with cuff insufficiency, and her glenoid component was loose. So at that time, we did work her up her shoulder for infection. That was negative. And these are her x-rays at that time. So we decided that we were going to go in and do a revision, and that revision was undertaken. The humeral component was well fixed, so we left that in place because our really goal was to augment her glenoid and try to improve her pain level and her function. So I bone grafted the cavitary defect of her glenoid after removing the glenoid component, and covered that with a fascia graft jacket, and then we did a pec major transfer. And I think she did pretty well after that for many years. Can you advance that? So this is her radiographs 1 year after that, and you can see on the axillary in particular, she had very good incorporation of her bone graft, so we really preserved her bone stock fairly well, and I think you're pretty happy with that?
Yes, until the reverse shoulder.
Right. Yeah, so she did well for a while. And
We're not done yet.
Yeah, they're not done. Go forward. And then in 2012, so this is, again, 5 years later, she came in with increased pain, loss of ability to lift her arm, and this was her good arm. So this was her good arm at that time. Once again, infection workup was negative, so we decided we're gonna go for the grand slam and do a reverse. So this is a picture of her immediate after her reverse. You can see I had to femoral strut graft her humerus because her bone was so thin after taking out the previous cemented prosthesis. And this just didn't go well for Ms. Ferguson. She immediately had pain, and I think for the first 6 weeks or so, you were feeling a little bit better, but then she started having pain which really seemed ridiculous in nature, which at the time baffled me. I didn't really know why that was. We were treating her with Neurontin, responded okay. Yeah,
Yes.
okay, go forward. And then 5 months post-op, she came in, and this is what the x-ray showed. Her glenoid component failed.
That was I got that phone call, Ted, this Sue, something just popped.
Yeah.
Very clinical.
So of course this was devastating for Sue, but we decided that we were going to again just revise her, but take it out and convert this to hemi, and so we did that. And it was interesting because she almost immediately had relief of that radicular pain. She was off the Neurontin within 6 weeks, and last time I saw Sue, she was actually doing really well with her function, and it's done pretty well since. So.
See what I can do.
Stand up, and we'll just examine behind the table, and specifically the shoulder over here.
Where do you want me?
She actually has pretty good function considering, and her pec transfer was still intact, although even when we did the reverse, so she can resist, not only gravity but a little bit of downforce. You get your hand to your head, and still has good external rotation, so she still maintains, very good functional shoulder despite, the deficiencies she has with the cuff and a conversion to a kind of a non-traditional hemiarthroplasty. But this is a good demonstration of what the quote salvage is for a hemiarthroplasty. I think Sue's been very fortunate with how she's done with it.
I think he's done.
I was very afraid in the beginning that I wouldn't have use of my arm anymore, and I do. So very, very lucky. Oops.
Oh, that's right. You want to say anything else?
Just in time. So, get to your head. You get to where you need to be functionally. So, and you do not have an implant in your right elbow anymore, right?
No, I do.
Oh, you do now.
After
Okay.
11 surgeries.
Okay, 11 surgeries on her elbow. So, what's your functionally with your elbow?
I have something called a boomerang arm. I know nobody knows what that is, but if I
Howard knows what that is.
it
Yeah.
snaps back on me, and I can hit myself in the face.
So it's a triceps deficiency.
Yes.
So, she's had the hand procedures, and still has the ulnar drift. Functionally does pretty well. How do you like your knees?
My knees are good.
They're
They're good.
damn knees.
Yes.
Okay. Okay. Thank you, dear.
Oh, you're
That's the
welcome.
conclusion. Okay.
These-